Hello, everyone. Welcome back. I'm so excited to have you here watching us again. I have an awesome speaker to introduce to you now. So let's learn about Dr. Erica Volk. They say you are what you eat. And while this may be catchy, the connection between nutrition and health is much more complicated. And that's why we're here today, to fill in the gaps that exist in traditional healthcare and provide actionable ways to change your health, eliminate your pain, and increase your quality of life without pills, procedures, or puzzles. I'm your host, Dr. Sarah, board-certified occupational therapist, and I'm so excited to introduce Dr. Erica Volk, a licensed naturopathic doctor and expert in being a health detective for individuals looking for answers to their health questions. Trained in primary care, she specializes in using clinical nutrition, counseling, homeopathy, botanical and prescription medicine, and sophisticated testing to treat a range of health concerns, including digestive disorders, hormonal imbalance, autoimmune disease, chronic inflammation, allergies, fatigue, and more. So for the next 45 minutes, she's going to dive into how nutrition and gut health contribute to widespread chronic inflammation and ultimately chronic pain and illness, and what you can do about it. Please welcome Dr. Erica Volk. Hello.
Hello. Hi, Sarah. Thanks for having me here.
Thank you so much for being here.
Awesome. So I'd like to say that I actually spent 5 years living in the States. So while I'm in Canada, I actually consider myself 1/7 American. So any Oregonians watching today, I am 1/7 you, I guess, I like to say. So anyway, I'm practicing in British Columbia in Canada. And today I'm going to talk about the role that food plays in chronic pain. So not necessarily specific foods, but how foods in any given individual's body can actually be a big factor that can really lead to pain. So the first thing I want to do this morning is tell you a story. So once upon a time, I decided I wanted to do this diet called the Whole30. And if you've heard of the Whole30, it's essentially an anti-inflammatory diet that is 30 days long. And it's a really nice diet because it's packaged as like a program. You can buy books on it, recipes, etc. And I wanted to do the Whole30, and I wanted my mom to join me because my mom had been in multiple car accidents and she had chronic back pain. And she also struggled with sleep, I think. And I was like, you might find that something like this could really help you. You should try this with me. And so she was like, well, I would, but I really don't want to give up my wine. And we do live in wine country. We kind of live in the Napa Valley of Canada. So, fair enough. But I was like, if you can give up this wine situation, you might find that it really helps. So finally, I twisted her arm and she decided to do the Whole30. And lo and behold, after 30 days of avoiding all of the foods that are on the no list in the Whole30, she saw a reduction in her back pain because guess what? What we eat does affect our pain. So anyway, it was just it's always one of those things that people don't really realize how much what they're eating can affect them until they actually make a change. And that's one thing that can be really difficult for people when you're talking about food. How do you get the motivation to make the change when food is so deeply ingrained in our identity and who we are and how we function and our routines? So to change that is actually a big ask. When I was in naturopathic medical school, we learned that making a dietary change is the most invasive therapy you can offer. And it's because it requires such a massive change on such a deep level. But I don't really believe much can help pain as much as changing what we eat if what we're eating is contributing. So how does food contribute to chronic pain? I'm going to be covering 5 different ways today. I don't believe these are comprehensive by any means. And I just want to say that while I am a naturopathic doctor, I'm not your naturopathic doctor. I'm going to try to give some takeaways today that you can use right now to help get yourself some answers if you are in pain so that you can resolve that pain. But it's always a best practice to work with a practitioner who can actually do the lab testing for you, who can actually guide you in your treatment. I was a self-treater for a long, long time before I discovered naturopathic medicine. And that's when I got better. I was dabbling in lots of therapies, but until you kind of dive in and get the information, sometimes it's hard to get exactly where you want to go. So the first thing that I want to say about how food contributes to pain is to talk about inflammatory foods. There are certain foods that are just always going to be inflammatory, no matter who you are or what your situation is. So these foods would be things like sugar, alcohol, right? So sugar can be any kind of sugar, white sugar, brown sugar, coconut sugar, maple syrup, honey. I mean, sugar is sugar. In the body, your body doesn't always know the difference. Some sugars deliver more nutrition with the sugar, but sugar can be very pro-inflammatory, meaning it causes inflammation. Inflammation isn't a bad word necessarily. Inflammation is part of a natural healing process. If you cut yourself, you need an inflammatory process to heal that wound. But when you have chronic inflammation, or inflammation that's not really associated with any injury anymore, that can really be a big factor in leading to chronic pain, especially like joint pain, muscle tightness or tension, things like that. So anyway, so sugar. If you're eating a lot of sugar or any sugar and you've never tried to stop, that would be well worth an experiment to see. I will say, like, while I'm not promoting necessarily the Whole30, quote unquote, as a program, I do like that it automatically removes all of these main heavy hitter inflammatory foods right off the bat. So if you're not sure what to avoid and you want to try an anti-inflammatory type of diet, it's nice. The Whole30 is also nice because it's only 30 days. So it's easier to bite that off than forever. To make a change forever feels like a huge, overwhelming task. Whereas a 30 days, a bite-sized dose of change that most people feel is reasonably approachable. All right. So other than sugar, alcohol. So going back to my mother's beloved wine. So alcohol does promote inflammation. So if people even just, a drink in the evening, and I've had patients who have, their one cocktail after work, and just avoiding that has resolved chronic inflammatory conditions. So consider that. MSG is another one. MSG is tricky because it actually goes by a bunch of different names. MSG can be also known as yeast extract, also known as autolyzed yeast extract, hydrolyzed yeast extract. If you're looking at an ingredients label, which is important to do if you're going to try to avoid these things, you do need to be aware that it goes by a lot of different words. And for those of you who are interested, I think on my website, I've got a cheat sheet on MSG, like terms that MSG goes by. So I'll provide links to my website and all that shortly. Sulfites is another one. So again, you'll see sulfites added kind of as a preservative in wines and things like that. So it can be problematic for some folks. And then preservatives and chemicals. So always, if there are ingredients on a label that you just don't know what they are, or maybe you can't pronounce, chances are they're not working for you. They're probably working against you. These are chemicals that we're not designed to ingest. And so those can be problematic for some folks. Trans fats is another. So most trans fats, I don't know, I think the guidelines now are that you have to, or companies must publish on a label whether a product contains trans fats. At least that's the case in Canada for sure. And so best to avoid those foods altogether. Unfortunately, in Canada, the only food that I've seen that I would regularly eat that has trans fats is Hawkins cheesies, which, if you haven't had them, are one of Canada's best junk foods. But they do contain trans fats. So unfortunately, they're out, which is really sad because I actually have pictures of me as a baby eating them even. The other food that I would say would be always pro-inflammatory is peanuts. So peanuts are a source of arachidonic acid. Arachidonic acid forms inflammation or causes inflammation in the body. So when you're thinking about nuts, we think nuts are good. I would say peanuts are less inflammatory than sugar, but peanuts, if you have your choice between peanuts or almonds, cashews, walnuts, other nuts, you're best to avoid the peanuts and go for the other nuts. Okay, so that's it for my number one topic, inflammatory foods. So second topic is food sensitivities, and there's a lot to say about this one. So food sensitivities can be very individual. What a food sensitivity is different from a food allergy. So a food sensitivity would be like, I eat eggs, and maybe in like 5 days from when I eat the eggs, I develop a rash. That could be a sign of a food sensitivity. Or it could be I eat dairy, and within hours, maybe I get a stomach ache. So I don't necessarily get a swollen tongue or sneezing. I might get these kind of more pain-related symptoms, more digestion-related symptoms. Food sensitivities are really, really common, and they can happen right from when we're born. The best test for food sensitivities is to do what's called an elimination diet. So the problem with an elimination diet is that it takes a long time and it can be really difficult to do. What you do for an elimination diet is you would avoid all the foods except for something like brown rice, which is generally fairly well tolerated. And then after a period of time, you slowly start reintroducing the foods one by one, which, as you can imagine, takes a lot of patience and isn't very fun and makes you sort of hate your life, because food is actually one of the things that we get the most pleasure out of in life, right? So if we're taking away all those foods for a long time, it can be very difficult for people. But it is one of the best ways of determining if you have a food sensitivity, because if I'm only eating rice and then I add in eggs as my first additional thing, and I suddenly start having stomach aches, I know I'm reacting to the eggs, right? So then I'm going to take the eggs away, wait a while, and then add in the next food, which might be, I don't know, dairy products. And then if I'm still reacting to dairy, now I know I have a sensitivity to both eggs and dairy. So this is how an elimination diet would work. It's actually more of an addition diet because we're slowly adding things rather than, but we do have to eliminate everything in the first place. So there are other ways of identifying food sensitivities. The way that I identify them for patients is to do blood testing. So the average food sensitivity panel could look at anywhere from 96 to 200 foods. You know, it can look at a laundry list of things, foods that somebody might be eating, and then it will actually see in its beautiful colored report, you know, what foods are showing up in the red, what foods are showing up in the green, and it will just tell us in a printout what somebody might be reacting to. Food sensitivities are not one thing that I hear a lot from patients who've had food sensitivity done in the past, food sensitivity testing done, is that they avoided all the foods that came up on the report, but they didn't feel any better. So if that happens, that can be a sign. What I want to say about food sensitivities is that we take those results with a grain of salt. So just because somebody, especially if somebody comes back, or a report comes back with tons of foods, like let's say we see 15, 20 foods that are all causing a red level or a strong IgG type reaction, a high degree of reaction. Probably in that case, it's not the truth that the person is actually sensitive to all of those foods. In that case, what we might be dealing with is what's called leaky gut. So when we're doing these tests, we're checking the blood for these reactions to foods. If we're seeing a lot of reactions to foods in the blood, like a lot, what could be happening is that especially when it's all the foods that are showing up are what the person is eating all of the time. So sometimes people will be like, weird, like I do eat a lot of mustard and the mustard came up. Probably what's happening there is we actually have leaky gut. So leaky gut is where we get, I'm just going to see if I have a way of accessing comments. I guess I don't. So leaky gut is where we actually get food from the digestive system leaking out of the intestines into our circulatory system. And then our immune system recognizes these food particles as non-self and starts to attack and create antibodies against the foods that we're eating. So think of your digestive cells, the cells that line your digestive system. They should be nice and tight together. They're actually put together with what we call tight junctions. So when those tight junctions get damaged from inflammation in the gut, we get leaky tight junctions, which is also known as leaky gut. Think of it like having a colander for intestines. Not ideal. We don't necessarily want, fecal matter and whatnot leaking through a colander and getting into our bloodstream. But that's kind of what happens with leaky gut. And a lot of people have leaky gut. It's a very common issue. So you can imagine the kind of inflammation you would experience or could experience if you're having a colander for guts and your fecal matter is like leaking into your circulatory system. I mean, it just sounds terrible just describing it, right? So if that's what is going on for you, then it could be that that's a huge player in your chronic inflammatory conditions. So what I want to say about that, one analogy that I use for patients is that, so if we have leaky gut and if we're showing up on a food sensitivity panel with lots of different reactions, then what can happen is, what am I trying to say? So if we have leaky gut, where am I going with this thought? We want to first identify what foods are leaking, but more importantly, why is that leaky gut there in the first place? So leaky gut can be just because of one, food sensitivity. So a classic example would be if somebody is actually like lactose intolerant or has a dairy sensitivity, and or just one or two food sensitivities like that are really legitimately their issue, where every time they eat that food, they're wired genetically, or they don't have the enzymes to break that food down or whatever, and it causes an inflammatory reaction. If they're still eating that food on a continual basis, that inflammation can snowball and become a much more serious problem in the digestive system. And then if that's happening, then we can get more and more foods showing up in the bloodstream that then promote more and more inflammation. So sometimes leaky gut can be caused by just eating dairy if you're dairy sensitive, and ultimately removing that food would be the solution. But more commonly, I find leaky gut is caused by some degree of imbalance in gut bacteria. So if somebody has taken a lot of antibiotics in the past, or if they've had a really high sugar diet in the past, those are really two huge reasons why we get an imbalance in gut flora. So what that can lead to is something like candida overgrowth or yeast overgrowth in the gut. Yeast is part of our natural flora, but when we eat a lot of sugar or even fruit or alcohol, we feed candida, we feed that yeast, and yeast can lead to lots of digestive symptoms, especially like bloating, fluffy stool, or like alternating constipation, diarrhea kind of stool, or always kind of looser, fluffy pieces. That's very yeasty sounding. So if a person has yeast overgrowth, and often people who have yeast overgrowth will have frequent yeast infections, they may have some skin rashes that are kind of itchy, perhaps in the groin area, under the bra line, in the buttocks region. It can really be anywhere though. Frequently, especially if it's like a pinkish kind of scaly type rash and it's sort of itchy and it kind of comes and goes, that's very frequently a yeast rash or a candida rash. So if people have candida, then that can lead to lots of leaky gut and lots of food sensitivities. So the food sensitivities are not the diagnosis. The candida is the diagnosis causing the food sensitivities. Hopefully that makes some sense. But in that case, eating those foods aggravates inflammation. We need to get to the bottom of it, though, which would be dealing with the candida so that we can correct the food sensitivities piece. And then the person would no longer potentially get to a point where those foods are no longer a problem for them. So I mentioned that candida is one factor. Another factor is very common. It's called small intestinal bacterial overgrowth, also known as SIBO. So SIBO also leads to lots of digestive symptoms, but can also lead to headaches and chronic pain and skin rashes as well. I mean, when our gut is out of balance, it can lead to a lot of systemic symptoms that we would not necessarily attribute to food or our digestion. Who would ever think that their headaches are related to their gut? But guess what? It's actually pretty common. So SIBO can be related to, or SIBO can be caused by taking too many antibiotics. It can be related to having had surgeries. It can be related to your thyroid. It can be related to, what else can cause SIBO? Delayed gut motility. So if you just, your bowel is just sluggish for whatever reason, maybe from nerve damage, maybe you had a really bad stomach flu at some point, any of those things can cause SIBO. There are a lot of causes for SIBO. SIBO is usually the underlying cause of about, I think the estimation is about 80-something% of IBS cases. So folks who've been diagnosed with irritable bowel syndrome, often if SIBO hasn't been assessed, it should be, because it's treatable and it could explain your symptom picture. And why go on through life with that? It's not, you deserve better. So anyway, so SIBO is an underlying cause of food sensitivities as well. So if I have a patient who suspects they have food sensitivities, sometimes before we do food sensitivity testing, I'll actually assess them for candida and or SIBO first. And then maybe once we've identified if those are a factor, then we would consider food sensitivity testing. If somebody just wants to know what the food sensitivities are and they're less interested in understanding the underlying infection, that's a reasonable thing to do. And we can still get information. Like I said, if a food sensitivity panel comes back positive for a ton of different things, then we're kind of getting some information already that there's probably an underlying infection of some sort going on. Parasites are yet another underlying infection that can contribute to food sensitivities. So, and these are really simple things to test. It's really just a matter of establishing care with somebody who has the capacity to do the testing, and you can get some answers and get on with your life. But anyway, so food sensitivities, is there anything else to say? So sometimes when people have had food sensitivities diagnosed, they think that they just need to avoid those foods for the rest of their lives. So if somebody has, reacts to eggs, potato, wheat, corn, and dairy, they don't necessarily need to avoid those foods forever. It doesn't mean that you are inherently, unable to digest these things. Usually there's a reason why, and if we treat that reason why, it's very common that we can reintroduce those foods at some point. But the analogy that I was going to say earlier that I use with my patients is, think of an IgG food sensitivity type reaction like an army. So think of it like a food comes in and it's like the enemy. So let's say your corn is the example. So corn comes into the circulatory system, and you've got an army who's like, hey, that's not normal, I'm going to start attacking. And so they bring out their swords and they're like slicing at this corn enemy. So, you know, the more corn that's coming in, the larger that army is going to get, because we need more forces to deal with this invader, right? So whenever we're trying to reduce a food sensitivity, you have to avoid that food for a long enough time that that army gets bored and kind of disperses, because they're like, you know, it seems like we've dealt with this corn situation, it's not coming back, so we don't need to be as high on alert anymore. And so that's really where and that window is usually around 3 months that you need to avoid a food to allow that immune reactivity to decrease to the point where you can get away with introducing it again and hopefully get away without any symptoms. Okay, that's all I want to say about food sensitivities for now. I didn't mention this, but anybody who's watching, if you have questions, please feel free to post them in the comments, or you can always reach out to me personally as well. I will be sharing my website and my social media links. Feel free to contact me in any of those ways. And while I don't have a lot of slides, as you can see, because I had death by PowerPoint all through medical school, I'm not interested in that for you. But if you'd like a copy of the information that I'm sharing, I do have an opt-in form you can fill out after the talk, and then I'll send you some summary notes on what I cover, so that you don't need to take stringent notes. You can just, I'm happy to share this information with you. Just sign up after the fact. And then, like I said, if you don't have your comments or questions posted during my talk, that's totally fine. I can respond to them at a later time. Individualized information obviously would require a consult with me, but just general questions about things I'm happy to share information about. Okay, so the third item, or the third way food can cause chronic pain, is if you have celiac disease. So this is a little bit similar but different to food sensitivities. So celiac disease is an autoimmune reaction to gluten. So there are certain grains that contain gluten, not all of them. You know, there are grains that don't contain gluten. Gluten-free grains would be things like quinoa, rice, corn. Gluten-containing grains would be things like barley, wheat. What else? Why am I blanking? Oh, rye. So anyway, if you are a celiac person, then no gluten-containing grains are ever going to be okay for you. And it doesn't matter how long you wait or how long you allow a break from it, it's always going to be a problem. It's an autoimmune reaction that has a genetic origin. So this is different from an IgG type food sensitivity that can kind of come and go with the times. Celiac disease is something that you were either born with, or you're born with a predisposition to, and then at some point you develop this issue. So celiac testing is done through blood testing, and I wanted to just go over it because it is important to do 2 different tests, at least when you're testing for celiac disease. Many people that I've seen as patients will say, well, I was tested for celiac and it was negative, so therefore I don't have this problem. But actually, when I look into the lab testing that they've had, they only had 1 test done, and the test can very frequently be falsely negative. So the testing that's usually done for celiac, and I will provide this information in my summary notes, 1 test is the tissue transglutaminase IgA, so TTG IgA for short. This is the main test that's done for celiac disease. And if that test is negative, often physicians will say, well, you're negative, so therefore you don't have this problem. Go forth and eat gluten to your heart's content. But the other test that's necessary is called total IgA, because TTG IgA is a kind of IgA. All you need to know about that is IgA is a kind of immune molecule. If you don't make enough IgA, then your TTG IgA is going to be low no matter what. So this is why you have to test them both together, a total IgA plus a TTG IgA, to make sure that you actually have enough IgA for the TTG IgA to even show up as a positive. If that makes no sense, just look at the slides and just ask your doctors for a full celiac panel looking at both IgA and TTG IgA. That's really all you need to know. Otherwise, you really aren't getting the information you're expecting you're getting. So celiac disease, we classically think about, like, symptom-wise, a person's going to have really terrible diarrhea all the time. Well, actually, not necessarily. Sometimes the only signs of celiac disease are low iron, or joint pain, or headaches, or, really non-digestive symptoms at all. In fact, more than half of people who have celiac disease present with symptoms that are not digestion related at all. So if you have chronic pain, you should be getting celiac disease ruled out. Just to know it's not a thing, because if you have celiac disease, the treatment for it is 100% gluten avoidance forever. So, and the reason why you would care, so like, why do we care about celiac disease? So because celiac disease is an autoimmune disease, autoimmune diseases tend to run in groups. They tend to go together. So if you have one autoimmune disease, it's very possible that you could develop others, or that you already have others as well. Because when our immune system is attacking self, it's not discriminating what kind of cells it's going to start attacking. So if your immune system is seeing, the reason why celiac is a problem is because every time you're eating wheat, or gluten, if your system is attacking that gluten, if you've got nearby, let's say like skin cell or pancreas or, digestive cell or whatever, your immune system can't tell what's the difference between self and non-self, and will just start attacking self. And whatever happens to be in the vicinity will also get attacked. So it's really common to see, people who have rheumatoid arthritis having celiac disease as well. And rheumatoid arthritis is another example of an autoimmune disease. So is type 1 diabetes. So if you have celiac, be aware that it could precipitate other autoimmune diseases developing. So this is one reason why testing it, which is so simple to do, can be very life-changing for people and really help you to resolve your pain. So that's one reason why it's a good idea to test. I guess the other thing I wanted to say about celiac, because sometimes people will test for celiac and it's negative, and it's actually negative. And oh, by the way, the only way to definitively test for celiac disease is to do an endoscopy with a biopsy, where they actually, stick a camera down your throat, look around at your stomach, take a sample, send it off for pathology. That is the gold standard for testing for celiac. Another thing to know about testing for celiac is that you have to be eating gluten for at least 6 weeks prior to doing the testing to get a positive test. So if you aren't eating it, you can't test for it and get an accurate test. It's just not going to be possible. So if you're concerned about your reaction to wheat, it is a good idea. I mean, this is a tough call sometimes. If people are not currently eating gluten and they want to test for celiac, the choice is either to just decide to act as though you have it and avoid gluten forever, or to reintroduce gluten for a period of 6 weeks. And the equivalent is about, or what you're supposed to eat is about the equivalent of a bagel a day. So like a significant amount of gluten for 6 weeks prior to doing the testing. People who know that they react poorly to gluten, or maybe they get bloated or whatever, or they know it makes them sick, are not excited about the idea of introducing it like that, knowing that it's going to be a really unpleasant 6 weeks. But that's sort of what that would look like. So if a person wants to test, that's kind of what you're facing. And it's a tough call to make sometimes. Often when I have patients who have kids, I'll suggest maybe getting the kids tested, especially if they're still eating gluten, or other members in the family, siblings, parents, if they're already eating gluten or still eating gluten. Sometimes testing them is a way to kind of get some background information. If a sister or a brother or a child shows up positive for celiac disease, and you already know you react to gluten, but you haven't been tested, then you can kind of make the jump sometimes and maybe get some information from that could help you. But I mean, usually if somebody reacts to gluten, they don't often want to eat it anyway. So what else do I want to say about that? So with celiac disease, it's not the case that avoiding gluten will resolve your celiac disease. It won't mean that you can tolerate gluten again. It will decrease your symptoms dramatically, but it will not mean that you can go ahead and in 6 months reintroduce gluten and you'll do better now. It's going to be a problem for life, unfortunately. So let's see. The other thing I want to say about celiac disease is some people who don't test positive for celiac disease but know they react to gluten should still avoid gluten. There is something called gluten-sensitive enteropathy. And this is where, and it's unfortunately the case, and I'm not a hater on gluten, but unfortunately, most of us actually don't do that great with it. It can be very inflammatory for the vast majority of people. One reason why is because gluten is grown with Roundup, not gluten. Glutinous grains are grown with Roundup or glyphosate. Glyphosate is incredibly toxic to our digestive system and immediately invokes or causes leaky gut as soon as we ingest it. So for people who are eating a lot of grains that contain gluten, if they're being exposed to the glyphosate that's part of the structure of that grain, then they're going to be causing leaky gut and inflammatory reactions in the gut, even if they don't have celiac disease. So celiac disease is the autoimmune piece, but most of us are going to be inflamed in the digestive system if we're eating gluten. The studies on animals have shown that within minutes of ingesting glutinous grains, there's intestinal permeability, meaning that colander type of effect in the gut. Somebody asked a question. Somebody asked if somebody has celiac disease and they're on a strict gluten-free diet, what are the chances of getting another autoimmune disease if they're very strictly gluten-free? I don't know the answer to that from a statistic perspective, but I would say that is your best chance. Like, that is one of the best things you can do to avoid that possibility. There are other considerations with autoimmunity, like other things you can do to help to shore up or heal up intestinal damage. So, I mean, the biggest factor is to try to keep the gut as healthy as possible. So there are, like I said, gluten isn't the only factor that can lead to intestinal permeability. Anybody who has intestinal permeability is at a higher chance of developing an autoimmune disease. So if you're, in this case, if a person is celiac for sure, but then also eating eggs and they are reactive to eggs and they're eating those eggs, the eggs may be contributing to intestinal permeability as well. And so even though you're doing a good job avoiding gluten, if you haven't identified those other factors, then it's possible that can contribute to further development of other autoimmune diseases later. Again, I don't really know the statistic for that, but that would be something to consider. So for a person who is celiac, who's maybe done the good job of identifying it, remove the gluten, still may be a good idea after enough healing has occurred to do some food sensitivity testing and rule out any other potential aggravating factors that could be contributing to further autoimmunity plus digestive symptoms. So especially if there are still symptoms going on in any capacity, and with kids, we can be thinking about behavioral, we can be thinking, developmental, can be lots of different things in kids, rashes, frequent immune issues, getting sick all the time. Those kind of things can often point to chronic inflammation or an immune system that's out of balance. Hope that answers the question. So basically, I think I've covered celiac disease as much as I wanted to. The main thing there is get tested. If you have if joint pain in particular, like if you have pain and you've had chronic pain for a long time, it doesn't hurt to get this tested. Like, let's rule stuff out so that you can get some answers. So, I've diagnosed people with celiac when they're in their 80s. Like, how long does a person have to suffer through their life before they finally get some answers? Like, it can be kind of crazy. Okay, so that's number 3 of my ways our food could be causing chronic pain. So number 4 is foods that have little to no nutritional value, also known as empty calories, or that kind of thing. So when we're eating a lot of processed or convenient foods, things like ramen noodles, right? How many university students get through university just eating ramen every day? Guess what? Ramen is just like empty calorie noodles with really no nutrition, plus a sauce that has MSG in it. Talk about inflammation. But anyway, also you're not really getting a lot of nutrients. So what I really want to focus on for number 4 here is the fact that our foods should be where we get our nutrition. So we need to get from our diet sufficient minerals, vitamins, amino acids, antioxidants, like all of these things that make our cells function properly. So if we're not getting these things from what we eat, we're going to have cellular dysfunction. Our body's not going to work right. All of the billions of chemical processes and things that have to happen on a constant basis to feel good may not be happening because we're not getting what we need nutritionally speaking. So, if the foods that we would be looking for that would be considered empty calories would be things that are largely sort of refined carbohydrate type based. So think about like muffins, cakes, cookies, bagels, those things that are easy to go and buy for cheap in huge amounts, and we can just throw some cream cheese on it and it's a meal, right? Those are really easy, convenient things to grab and go, but they really don't give us a lot of the nutrition that our bodies need to function properly. So I just wanted to kind of go over some different areas where if we're developing nutritional deficiencies, where that can really show up. So Some of the chronic or classic nutritional deficiencies that we might see would be something like a vitamin B12 deficiency. And by the way, these nutritional deficiencies can be tested for. You can actually get a test to look at your nutritional status and identify what is your level of different vitamins and minerals in your body, and is there anything you're showing up low in. If you're low in certain things, you can supplement or you can change your diet. In a dreamy world, we would get everything we needed from our diet, but the vast majority of us do not get on a daily basis all of the vitamins, minerals, amino acids, antioxidants, etc., that we need to function as well as we could. So this is where supplementation has become a multi-billion-dollar industry. It actually does fill in the gap. So if we have a day or where maybe that particular day we just had to eat fast food because we were traveling and there was nothing or whatever, then maybe taking your multivitamin is going to fill out the gaps and give you what you need. The thing with supplementation is if your digestion is a mess, you're probably not absorbing your supplements even as well as you could. There's also a huge difference between quality supplements and poor quality supplements. They're not all equal. To go to your local drugstore and buy a tablet of something versus a capsule of something that's a professional grade formula, those tablets are loaded with fillers, chemicals, other stuff. You have to have the stomach acid to break down that tablet so that your body can actually absorb it. Plus, then your liver has to filter all the other agents that are added to that tablet versus a capsule, which is easier to break down, or a liquid that has, a more easily absorbable form. So there's even different forms of certain vitamins and minerals. So my point here is just that different supplements are different. And in fact, they're not all the same. Just because you're taking a B12 does not mean that it's working for you if you are using a poor quality one, or if your absorption is low or whatever. So these are also reasons why working with a healthcare practitioner is a very good idea when we're talking about supplementation. So anyway, B12, what is the point of, how does B12 deficiency present? So B12 deficiency, a classic sign for that will be numbness or tingling, so neuropathies. So if you're having issues with nerves and how your nerves are transmitting, one of the main functions of B12 is to support nerve function. So, if you have neuropathies or like lots of numbness, tingling in your hands, feet, it would be well worth it to check your vitamin B12 levels and see if that may be something that would be helpful to either boost in your diet and or as a supplement. And are you absorbing it is the other thing that I always throw in there. Even if you are taking a supplement, if you're not feeling better from it and you need it, well, what the heck is going on with your digestion? So, okay, that's B12. So the next one would be magnesium. This is one that I see a lot. So magnesium can lead to chronic pain in the sense that a deficiency in magnesium can lead to lots of muscle tension. So we need magnesium to relax muscles. If you are deficient in magnesium, you may have chronic muscle tension. So we can see anything like TMJ, chronic headaches, lots of like tightness in the upper traps, but liver tightness can be anywhere. Sometimes just supplementing with magnesium can lead to a huge reduction in some of that pain and tension. Plus, magnesium is just one of those amazing minerals that does, thousands of things for us, including like hormone balancing and neurotransmitter production and etc. So anyway, it's a good one to, I'm not suggesting you go out and buy magnesium, but getting it tested is a good idea if you have chronic pain, especially if it's in the tension variety. So vitamin B6, so another, B vitamins in general actually are largely very implicated in pain syndromes. So if you're deficient in B vitamins, across the board, a lot of them do have a role there. So B6 is another one, also known as pyridoxine. So B6 would be another example of a vitamin where you might see numbness and tingling in the feet or hands. So again, we're dealing with nerve issues. So if you have nerve type pain, then B6 would be something worth testing and potentially supplementing with if it were low. The other B vitamin that I would look into would be vitamin B1, also known as thiamine. So thiamine B1 is used for, sorry, what am I trying to say? Oh, if you're deficient in that one, it can lead to burning pains. So burning pains are a little bit more unique, right? So if you have burning pains or muscle cramps, you can potentially be low in B1. The other nutrient that makes a huge difference when it comes to inflammation and pain in general would be something like omega-3 fatty acids. most of us have a diet very high in omega-6s. So I'll have patients who are taking like an omega, they're so proud they're taking an omega supplement, but it's like an omega-3, 6, 9 or an omega-6 or something like that. I'm like, skip the 6 and the 9, just do the 3. You don't really need the 6 and the 9, especially if you have inflammation or if you're in pain. So omega-6 and omega-9 are what we call pro-inflammatory omegas. So like I said, inflammation is not in and of itself a dirty word. We need inflammation on a regular basis in our body to heal and repair damaged tissue. It's part of the natural healing process. But if we're eating too many foods that are promoting inflammation and not enough foods that are countering that, like we need to have that shutoff switch readily available. If that shutoff switch is not there, then we can have chronic pain. So omega-3s are the shutoff switch for the omega-6 and 9. So most of us have a ratio of about 20, sorry, that's my puppy, 26 to 1 omega-6 to omega-3. So that's obviously a lot more omega-6s than omega-3s. So most of us have a very inflammatory diet and not nearly enough foods that are countering that inflammation. So foods that contain omega-3s, obviously working with a food level, using your food as medicine is the preferred option. So fish contains omega-3s. Where algae can be a source if you eat a lot of algae, and most people probably don't. But then foods like walnuts, chia seeds, flax seeds, these can all be a source of omega-3s as well. But if you have a chronic inflammatory condition or even an autoimmune condition that's contributing to chronic pain, supplementation really does help you to get that level up higher, faster. So I had a patient with scleroderma, which is an autoimmune reaction, which led to a lot of tightness. All I did for her was put her on a high dose omega-3 and her pain like resolved overnight. It was beautiful. But I mean, high dose. And omega-3s are not just something that are inherently safe in high dose. They do have a blood thinning capacity. So if a person is on blood thinners or has a bleeding disorder, it would be something to be aware of before implementing omega-3s. But omega-3s are a very lovely supplement that can be very helpful for reducing pain. And with omegas, there's a lot to know with respect to how to read the label, how to identify if it's a good one, how to identify if it's actually a therapeutically effective one. Just because an omega-3 tells you on the label that it delivers 4,000 milligrams of omegas per dose, it doesn't mean that you're actually getting the good stuff. So if you want to learn more about omegas, check out my Facebook page. I post a lot of stuff about label reading and whatnot on there. But yeah, so that's something important to consider when you're supplementing. Okay, so I think that's all I wanted to say about foods with little to no nutritional value. Think about when you're eating, what nutrients am I getting from this food? If you can't really answer that, then it's probably a good idea to consider making some dietary changes. Okay, so number 5, for the 5th way that your food could be causing chronic pain, would be if you're just eating too many calories, which leads to weight gain, which can put strain on your joints and cause pain. So, I mean, this one is kind of a no-brainer. I don't really need to say much about it. But if you're eating more than what you're spending, so if your fuel coming in is exceeding what fuel is going out, that can actually put on excess pounds on your body, which can put strain on your body. So, it's something to consider. This note, how much are you actually eating? Are you spending that fuel? If not, you may want to decrease the calorie intake. And I'm a proponent of health at every size, but if a person is in chronic pain and it's large and it could be related to how much weight they're actually having to haul around with them, then sometimes just reducing the weight or the calorie intake can have an impact on reducing pain. So those are my 5 ways that food could be causing your chronic pain. So, now what? What do you do with this information? So I would say this first thing I would recommend is if your digestive system is a hot mess, meaning if you experience irregular stools, so if maybe you've been diagnosed with irritable bowel syndrome, perhaps you have lots and lots of bloating or any bloating. Some people will say, I'm just bloated every night, I'm bloated. I look like I'm 6 months pregnant. So if you're bloated regularly, or if you're experiencing lots of gas, or alternating constipation or diarrhea, or if you're on the toilet for, too long in your day, maybe start with your digestive system. Fun fact, I just looked up a statistic. Well, I didn't look it up, I calculated it. So if the average person were to spend 10 minutes on the toilet a day having a bowel movement, which I'd say is like pretty good. Like if you were only taking 10 minutes out of your day every day to poop it all out, get rid of your waste, by the time you're 50, you would have spent 127 entire days on the toilet of your life. That's a lot, right? But then if you think about how a lot of people actually spend more than that 10 minutes a day that gets a lot more. Probably people who have irritable bowel syndrome have, by the time they're 50, have probably spent like a year of their life on the toilet, which is just unacceptable. We have so much life to live aside from just being on the toilet. So if digestion is a mess, start with that. Number 2 would be eliminate inflammatory foods like sugar, alcohol, trans fats, and refined carbohydrates. So another role that refined carbohydrates will play is if you have yeast overgrowth. So like I said, we all have yeast. If your yeast has grown over, largely that may be due to feeding it refined carbohydrates. Very frequently when we try to make a dietary change, especially if it leads to cravings. So like if you're trying to decrease your sugar, but then you stop eating sugar and you're just like going insane with cravings of sugar, that's a very red flaggy symptom that you probably have some degree of yeast overgrowth. Yeast actually puts out chemicals that cross the blood-brain barrier and make us crave the food that will feed the yeast. We're kind of like robots that just eat, according to our gut bacteria. Our gut bacteria can really affect what we crave and what we want. So if you're finding that food cravings get really intense when you try to make dietary changes, that can be a sign that you have some yeast. I'm just going to scroll to my next slide, which just shows my contact information. I'll continue to talk, but please feel free to post any questions if you have any. I'm wrapping up here, but I'd like to answer anything that comes along. How do I do this? Here we go. So hopefully you're seeing my contact slides. So anyways, I'll carry on. So avoiding inflammatory foods, eliminating those from the diet is going to be the second thing anybody could do or want, or feel very comfortable to do that should help you to feel better. The third thing would be, if you're not sure what to eat, people often don't know what to eat. It's a very common, it's like, okay, I know that my diet's terrible, but what do I eat now? If all you did was try to increase your nutritional intake by filling half of your plate with fruits and vegetables, you're already increasing your nutrition a lot. So just think how much of your plate every time you eat a meal or a snack consists of a fruit or vegetable. Try to make it half. Making it half will already increase your nutritional intake significantly. The next thing you can do is get tested for food sensitivities or do an elimination diet, right? So if you're curious about what foods might be triggering you, and maybe you have a suspicion, like maybe it's like, well, something tells me that I feel like eggs are just a problem for me. Cut them out and see how you feel. The best way to determine a food sensitivity is to eliminate that food and just notice how you feel. Generally, you have to eliminate the food for about 2 weeks on minimum to start to see a change. So that's a good idea to do that. The reason why food sensitivity testing is what I recommend is because even if you suspect one food is your issue, if you only avoid that one food, but you actually are also reactive to 5 other foods, you're not going to get the same degree of benefit as you would have if you had avoided all of those foods, right? So it's a good idea to do the testing, but an elimination diet would be the next. I mean, it is the best way to test, but like I said, it isn't without challenges. I mentioned the Whole30. I do like that program as a way to identify food reactions as well. The reason why is that the Whole30 removes enough foods from the diet for long enough that most people will see if those foods are affecting them in that time. Going back to the story of my mother with her wine, she didn't really expect to see much benefit and was very impressed to see how much those foods actually the wine and all the other things were actually contributing to chronic pain that she had just written off as being related to being in car accidents, right? So even if you have had injuries that have led to pain, it doesn't mean that your diet isn't playing a role. So the Whole30 is nice because, as I mentioned, it's a bite-sized diet. It's 30 days. You can easily take that on and then learn from it. And then after the 30 days, you can use it actually as a mini elimination diet where at the end of your 30 days, you may want to slowly introduce the foods that you've eliminated one by one. So Whole30 will also avoid grains and dairy. So, you wouldn't want to end the Whole30 and then the next day eat like a Black Forest cake loaded with like milk and whipped cream and all that stuff. At that point, it becomes really hard for your body to tell how things are affecting it. You really want to try to introduce one thing at a time so that you can see what's going on with your body and each food individually. The next thing that you can do is focus on increasing your sources of omega-3s in your diet and or consider a supplement. So as I mentioned, the caveat there would be that if you're on any blood thinning medication or if you have a bleeding disorder, you don't necessarily want to load up on omega-3s. That can be a problem, but most people don't get enough, as I mentioned. So a question that came, can you do the mail away food sensitivity testing or will a GI doctor test for this? So I don't know. I don't think most gastroenterologists in the US will do food sensitivity testing. Maybe if they're functional medical doctors and they've got some training in it, they might. But at least in Canada, and I mean, I know about the American health system. I remember I'm 1/7 American. To my knowledge, most doctors, most conventional MDs don't do food sensitivity testing. There are a variety of ways you can get tested. So one way is to have a practitioner provide you with a test kit. You know, some classic labs in the U.S. that do food sensitivity testing are U.S. Biotech, Meridian Valley. There's Genova. There's Great Plains Lab, Cyrex labs. There's a ton of labs in the States that do food sensitivity testing, and they all have test kits. So if you had a practitioner who had a kit, they would provide you with the kit. You'll usually do blood work, either getting a blood draw, or often you can do a finger stick collection where you just poke your finger and you're just squeezing drops of blood onto a little card. Then you would mail that in, they analyze it, or your food reactions, your IgG food reactions, you get a printout and you're set. There are other ways of assessing for food sensitivities that use like muscle testing or something called EAV testing. Electroacupuncture by Volk is what that stands for. EAV testing would be, that's what I experienced once upon a time. The first time I ever explored any of this stuff myself, I had EAV testing done. You know, it was kind of wacky. I held a little probe and then I had my fingertip poked with a little stylus thing. And then I watched on a screen as this sound came up. Like when I would be poked by, I don't know, cheese, it'd be like, wee! And then poked by spinach and it was like, woo! And usually the high sounds meant that. So anyway, so there are other testing modalities out there. They're all kind of roughly equivalent. So I don't know about the ones necessarily that you can like order yourselves, but if it's done through a lab that's ordered by a practitioner, I would say those are usually, they're all kind of similar-ish. I can't speak to the ones that you can just order yourself. But yeah, so it's really fun. And I think it's fun. I think it's the kind of testing that most people should do at least once in their life, because it can be so life-changing for people. You know, if you find out when you're 50 that you should have been avoiding eggs forever, that's really helpful to know. And why is it helpful to know? Because most chronic disease like cancer or, you know, issues with organ systems like kidney damage or kidney dysfunction, they come from chronic inflammation. Inflammation doesn't just start overnight and now you have cancer, right? These are processes that take a long time to develop. So the sooner you can identify if there's chronic inflammation from any cause and resolve that, the better your long-term health should be. And I mean, there are a lot of factors that contribute to chronic inflammation aside from food, you know, things like environmental toxins, mood, stress, like how we react to the stress in our lives. Like a lot of these things can affect our chronic levels of inflammation, but food is a massive one. So start there. And then the next thing you can do for reducing getting where to start would be to exercise. If you're not already exercising, start exercising to tolerance, and it already starts to help your body to eliminate toxins, and it can help to, like I said, if you have excess weight that your body is burdened with, exercising can help to start to eliminate some of that so that you can start to feel better. So that is basically all I have to say. Like I said, for those of you who want your pain-free food cheat sheet, please go ahead to my website. I posted the link and you can sign up for that. And then I'll send it to you in your email inbox. I post lots of talks like this on my Facebook page. So if you're interested in following me there, please do. I've also got my link there. And then I'm also very active on Instagram. So check me out there as well. And that is all I have to say for today. If there are no more, ask more questions.
I have a question for you, actually.
Oh, sure. Go ahead, Sarah.
I'm going to pull your slides down so I can see us. You talked about the elimination diet and cutting out sugars and cutting out carbs and cravings. When you start a diet like that, like if you just cut out all your sugars, how long does it take for those cravings to typically go away, for your body to readjust to that kind of a diet?
It really depends on the situation of your gut flora. So if you have, like if a person has really bad yeast overgrowth, until we're actually dealing with the yeast itself, the cravings can go on for a long, long, long time. You know, if a person is, I would say if a person does an elimination diet and they're having really intense cravings, and I will say from personal experience, this happened to me. I originally, or the reason I became a naturopath in the first place was because I finally in my 20s was diagnosed with candida overgrowth. And I avoided all of the sugar, and the cravings were so intense and I was so irritable. I had to stay home from work, I think for several days. I couldn't even function to go to work. Like it was like coming off of drugs. I mean, sugar is a drug. It is. It is more addictive than cocaine. Like it's quite intense. But if you have candida, and at the time I was also using an antifungal medication to kill off the yeast. So, and it took me several days of the cravings to kind of start to come to the other side, where I started to feel like a normal person again. But if a person is not treating the candida and it's there, so if a person has a raging fungal infection and it's just, you know, you will slowly start to starve off that candida with time, but you are looking at so much longer of suffering if you're not actually targeting or dealing with killing off the yeast in that's there. And, you know, supplementing with something like a probiotic can help, but probiotics don't kill yeast. They outcompete yeast. So with time, the probiotics, you know, colonizing in your gut, making a home there, will slowly start to drown out some of that candida. But like I said, if you have a really severe candida issue in the first place, you could be looking at like months before you start to see that balancing out. So I just give the drugs or the herbs because it's like, why suffer? I mean, it takes too long. It's not.
So if it goes more than like a few days, that's definitely an indication that you need to go get some more help with that, because it's probably bigger than you can deal with on your own.
Yes, for sure.
Okay. And then I had one more question.
Sure.
I know I've read before, when you go to like a keto diet where it's really low carb, people get a lot of different symptoms. You might start developing headaches, or you might have some GI symptoms. Other than those things, are there any common symptoms that are associated with elimination diets that you would expect to see, kind of like a you get worse before you get better situation?
Yeah, often we'll see skin symptoms. So somebody might have, you know, a breakout of eczema, or psoriasis might get worse, or something like that. Acne might really start to flare. If your body is shifting from a state where it's been burdened by a lot of inflammation, or, you know, toxins or chemicals, and we're moving you into and again, if you've got bacteria or yeast overgrown, and then we're shifting your body into a place where those foods that are feeding those bacteria or yeast if we're decreasing the foods that are feeding those infections, then those infections are going to start to die off. Like we're going to start to see the dying of the bacteria, the dying of the yeast. And as those pathogens are actually dying, they release a lot of toxic metabolites into our bodies that can lead to any degree of symptoms. It could be worsening of, like you mentioned, headaches, but also joint pain, fatigue, feeling really sluggish. Like you mentioned, all of the digestive symptoms would be on the table: nausea, vomiting, diarrhea, constipation. Constipation is a big one, because when your body is clearing all of the junk that has been stored for a long time, it can sort of cause a backup, which is one reason why it's not a bad idea when you're doing a detox of any sort to really be mindful about supplementing with lots of water, lots of fiber, to try to keep those toxins being flushed out of your system and not backing up and forming a big plug, right? We don't want, constipation gets in the way of your body's ability to detoxify. So, but it could be anything. I mean, sweating, agitation, mood issues, irritability. I mentioned skin rashes. I mean, literally anything. I mean, if you think about how much goes on in our body. But yeah, any signs that your body's getting worse are usually a sign, like a bit of a detox reaction, that your system is adjusting to eliminating some kind of toxins. And so just try to hang in there if that happens, and be drinking your water. But I mean, if you're doing an elimination diet and you're going from eating lots of foods to only eating brown rice, we also need to be mindful of the fact that you may be also nutritionally deficient at that point, depending on how long you're going to be riding it out without a lot of food variety in your diet. At that point, it may be a good idea to be supplementing with some good multivitamin, multimineral, so that you're not running the risk of actually developing B12 deficiencies, magnesium deficiencies, et cetera, because that can also contribute to your symptoms in addition to the detox reaction.
Yeah, that makes sense. Awesome. Well, thank you so much for being here. That was a great talk. So much information. And I know you really only scratched the surface. So if you guys have more questions, or if you're watching this on the replay, you know how to get in touch with Dr. Volk, or you can post in the Facebook group and I'll make sure those questions get answered. I'm pretty sure she's in there as well. So she'll see them too. And other than that, say goodbye to Dr. Volk. Thank you so much again. Thanks
so much for having me, Sarah.
And I will see you guys this afternoon. You get to spend some time with me. I'm going to talk about a little bit of review about the stuff we covered earlier, and then walk you through some stretches and some exercises that will really help you get into your fascia. So I'll see you guys in a few hours.